One of the reasons that the sciatic nerve, which is the yellow part here, becomes trapped and painful is because the pelvis moves out of position and causes this muscle here, the piriformis, to tighten, which can actually nip or scissor the sciatic nerve, causing classical symptoms of sciatica, tingling, pain or numbness down the leg. One technique that we can use to relax and rebalance the piriformis muscle and take pressure off the sciatic nerve is by going to the tendon of the muscle where it attaches at the hip. At this junction point, there's specialised receptors which control the tension of the muscle, and there's also an important pressure point that actually can help to release tensions into the hip and into the lower back and take pressure off the sciatic nerve. So to find this point, go to the big bony prominence that you can feel on the outside of the hip, and then just follow this in very slightly and you'll come to a little depression. Now this is where the piriformis muscle attaches and where the pressure point is. So we're just going to stimulate in that area with a firm rotary pressure for around 20 to 30 seconds. Now this helps to relax the piriformis muscle and also stimulates the pressure point, which can help to release tensions into the hip and also into the lower back as well. So we want a firm pressure in that point for around 20 to 30 seconds. For a bit deeper correction, you can also use a massage tool, or this could be something to substitute a household item, something like the end of a wooden spoon. I'm just going to use that to put pressure on the point and stimulate again for around 20 to 30 seconds. This just allows you to get a little bit deeper pressure and to help save your fingers as well. For more dynamic correction, you can actually hold the point and then flex the hip up. So bringing the knee up to 90 degrees and then just taking the leg back slowly and straightening the leg out and just repeating that process around 5 to 6 times. That helps to reset the piriformis muscle and also help to stimulate this point, taking pressure off the sciatic nerve. If you've got pain or problems in the lower back, you'll probably find by doing both of these sides, one will feel slightly tighter than the other, and that might actually not be the side where you actually get the symptoms. Because often in the body, wherever you feel tension or pain, the problem's actually coming from the opposite side. So always make sure that you do this technique on both sides to help to balance the position of the pelvis and relax both of the piriformis muscles to take pressure off the sciatic nerve and into the lower back.